Welcome back. We're going to start the afternoon with our opening 55-minute roundtable dedicated to the empowering innovation in healthcare post-pandemic. And to moderate this, I have the pleasure to call the former French Minister of State for Industry and SMEs, Christian Pierret.
Thank you very much. Thank you very much. I'm very pleased to begin our afternoon with personalities and like Patrick Artus, Jan-Philipp Beck, and in TV conference Pierre Gattaz, Randall Kroszner, in Bertrand Lepine, who will attend in a few seconds. I think that Bertrand Lepine is in near here, or a video, or presential. Well, okay, we'll see. Well, my job today is to make a short introduction of our debate about the framework of the economy in Europe, and especially towards the sector of health, digital, and innovation sector, which is becoming, as said this morning, as more and more important in the global economy, and especially in Europe today. So, a few words, very shortly, to define the several and serious consequences for European economy of the crisis, COVID crisis. Well, I should underline the lack of qualified workforce within the framework of rise of unemployment, very well known, even now redeclining, long-term tendency, growth declining down to negative figures last year, and especially I have to mention the rise of indebtedness of states and of companies, which would be the first problem we are matching. I recall that PGE, le PGE in France, was of an amount of more than 400 billion euro. That's a huge amount, but without it, a number of firms will be bankrupt if not totally disappeared. The company's debt has increased very, very highly, and it's a first problem we have to cope with. Central banks' quantitative easings created last year about 24,000 billion dollars. That's to say a huge increase of between 60% and 70% of money money in the economy. So the first problem, indebtedness, in a situation where liquidity is overall the reality and a possibility. And the first question for us is how to mobilize this huge money towards investment, towards creation of worth, and towards creation of value, and towards creation of innovation. I think that the second, after the indebtedness, the second problem is deepening, above all in France, as a consequence of COVID, of the lack of equity capital. Lack of equity capital is our day-to-day landscape, unfortunately in France and perhaps in many other European countries, with an obvious consequence. we are suffering from. It's a limitation of investment and reduced possibilities of innovation and capacities. So I think that after this short description of landscape after COVID, I should, as said this morning quickly, that a new economic paradigm is appearing. EU accepted for the first time to take away sailing deficits. I'm not sure that it is definitive, but I think for the first time it is the contrary of the dogma, classical dogma and classical position of the country, influenced by Germany as a good way of managing the economy. But matching the crisis, the sailing deficit is away for a time. Secondly, it is allowed to support a sectorial recovery. You know that the only sector in which it was authorized is the climate change and the energy transition. Now, the sectorial recovery is not a bad work to support a sector and to boost a sector, digital sector, for instance, and the conscience that nothing is possible in Europe because of our scale. Nothing is possible without a certain intervention of the states, mutual intervention of states to create an offensive sector in digital is the new component of the paradigm of the economy. Third, we are very happy to see that we will able to launch mutualized borrowings. It's a rupture with the past, and it's not a bad word, it's not unpolite to talk about industrial policy and even to relocation of certain activities. So the framework we have to talk with, if you do agree, is to rely a new economy, new paradigm on 3 pillars: skills, more skilled workforce, and scientific skilled workforce. We should emphasize on this point. We need of new skills and more skilled workforce first. Second, investment, and in the frame of investment, we need equity investment, and we need to talk not only about public subsidies, public support, but about healthy equity involvement. And third, research and intellectual property. Nothing could be possible to restore a good growth and to restore a forward move towards a new economy without intellectual property. To conclude this introduction, I will recall the Mrs. von der Leyen speech in the State of EU report in 2020. Access to medicine in avoiding shortages, support pharma industry on its path for innovation and R&D, ensure sustainability, economic and environmental level, and develop synergies between R&D, industrial policy, competition, which is the rule, and it's good, and so competition and commercial policy. So if we follow this new path, we give us many opportunities to rebound and to have a new kind of growth, a new quality of growth, a new future. So my first question will be directed to you, Patrick, I think. Video from Mr. Gattaz, yes. Mr. Gattaz speaks to us now.
There are three reasons for Europeans to have hope for the future. First reason, the European Union has shown its resilience to the sanitary crisis. I would like to recall that more than 70% of adults in the EU are now fully vaccinated, in line with the objectives outlined in spring 2021. Europe is the only continent that achieved this. This crisis has proven that together we are stronger. Second reason, the EU has shown that it has taken the measure of the economic crisis by adopting an historic recovery plan, a plan of unprecedented scale. The 750 billion euros of the European Recovery Plan offer a unique opportunity to transform our economies, increase productivity, boost growth, and improve competitiveness. Thanks to these sanitary and economic measures, we have an economic recovery in Europe, and BusinessEurope expects the EU economy to grow by 4.4% in 2021 and by 4.6% in 2022. Third reason, the EU is investing in the green and digital transitions to make sure that EU funds deliver a lasting and sustainable recovery. During the summer, the Commission published the so-called Fit for 55 package, with a series of legislative proposals aimed at meeting its climate ambition to become the first carbon neutral region by 2050. The first danger is excessive or badly shaped regulation from the EU. European companies cannot absorb additional burdens on top of the crisis. I mentioned earlier the Fit for 55 package. For BusinessEurope, the direction is the right one, but the devil is in the details. For instance, the carbon border adjustment mechanism, the so-called CBAM, foreseen in this package, could lead to additional cost of roughly 130 euro per vehicle in the automotive industry because of the impact of the CBAM on steel increase. The second danger comes from increased tensions in international relations. European companies are feeling the pain of trade and geopolitical tensions between the US and China. The tensions between the EU and the UK are also impacting negatively the recovery for many companies. I see four priorities to strengthen today's recovery and ensure long-standing prosperity in the European Union. First priority, we need to put in place a well-articulated European economy agenda. An agenda focused on innovation and competitiveness, because these are the two engines for lasting employment and lasting prosperity, innovation and competitiveness. Second priority, we must have smart regulation to protect people and the planet. EU legislation must not overburden companies. And third priority, we need to fully restore the single market and improve its functioning. It is our home market, the backbone of our economy. It must function smoothly, even during a crisis. Last but not least, the European Union has to be more assertive globally. BusinessEurope is in favor of qualified majority voting in European foreign and security policy instead of unanimous voting on those topics. Europe needs to speak with one united voice to better defend its interests in the world.
Thank you, President Gattaz. Patrick Artus, Chief Economist to Natixis. What is your analysis about what said Mr. Gattaz about how to get out of this crisis? And in particular, as a specialist of this question, the role of the central banks in creating money. What is your forecast, your personal forecast about that?
Thank you, Christian. Good afternoon, everyone. So, what should I do?
Maybe try again. I think they will switch it on.
It's is it better? Yeah. So good afternoon, everyone. So, Christian, yes, I will answer that. But I really want to focus on the question of something like healthcare and growth. I think this is really what we are looking for. So I want to address three issues here, three economists' views. I mean, of course, on this very important question. So one is about innovation. So what do we know about innovation? What works? How can we improve the European situation here? Second question is about long-term growth. There is a lot of research, I will tell you why, which is now devoted to trying to understand what's determining long-term growth. What do you do if you got more growth, if you want more growth in the long run? And the third issue is precisely Christian's point. How does that interfere with the very bizarre fiscal and monetary policies we've just been facing the last few years, I mean, especially since the start of COVID. So my first point is on this question of innovation. We know, I mean, and again, I take here an economist point of view, very voluntarily. We know that what's missing in Europe is disruptive, breakthrough innovation. The level of disruptive innovation is much lower in the US than in Europe. And we have a real clear idea of what's causing that. I mean, the first issue is what I call top-down versus bottom-up. In the US, you got a very nice mixture of that. I mean, for instance, the US government decides about in which areas do you need a new innovation, do you need really to concentrate research. For instance, I want to be able to launch a satellite with this probability of success and with about that cost. This is a top-down thing. I mean, and then the bottom-up part of it is that the company then says, okay, I have a patent which is answering that. I can just have a product which is meeting your question. And I think this is really a nice mixture between being, sufficiently precise in the top-down approach, but letting a lot of freedom to the companies, to the labs, I mean, in this bottom-up approach. In Europe, traditionally, we are not very good at that. Especially in a country like France, I think I should not tell that to Christian, but the government has been much too precise in the top-down part of that. Going to the details, to the technical details of the product, of the vaccine, of the whatever, I mean, instead of letting more freedom, I mean, more capacity to develop new products at the bottom level, I mean, as a company level. So I think we have to move towards a DARPA, BARDA type of approach to that. The second very complicated thing in Europe, and I think this is also very much the case in France, is how do you put public money at risk? I was in a meeting this morning at the Ministry of Finance exactly on this question, and it's extremely complicated in a country like France, and I think this is valid for most of Europe, to lose public money on a project. You take a risky project, you got a 60% probability that it doesn't work. You need a lot of public money to start it. Does the state accept to lose hundreds of millions or billions of euros of money on something which doesn't succeed? And so far in Europe, and especially I think in France, the answer is no. So we don't put public money at risk. And this is explaining a lot when you look at what's going on with vaccine research. When you look at space, we have exactly the same problem. We don't want to have this rocket which lands by itself. It's something the Europeans could have done, but putting too much public money at risk. So we have to learn to put public money at risk if we want to improve and to develop these disruptive innovations. My second point is even more an economist point. It's on long-term growth. But this point will be very important. Very shortly, the European Union, as European Parliament, will design new fiscal rules for Europe. And in these fiscal rules, there will be a special treatment of all whatever public spending or public investments with a clearly positive effect on long-term growth. Very likely, these parts of public spending, which again permits to have more growth in the long run, will be allowed to be debt financed, whereas the rest will be very much more constrained. So it's very important to be able to know as well as we can what's really causing long-term growth, just making it that we can have more growth in the long run. When you do that, and the state of research is the following, you got 3 items which seem to have a very significant positive effect on growth in the long run. One is competencies, skills, well, it just makes sense. One is R&D overall, but one, very surprisingly, is public healthcare spending. And public healthcare spending has an extremely significant effect on long-term growth for reasons we can think of. For instance, if you've got a population in a better situation of health, this is, of course, very good for growth. Think of what's going on in the US, for instance, what we had in the last 10 years with all the health problem of the middle class in the US, leading to a big decline in employment. So I think there is a real basis, scientific research basis, to have a special treatment for healthcare spending in the new fiscal rules we'll be facing in Europe very shortly. And my last and third point is very important question Christian raised on how does all of that associate with fiscal and monetary policies. We've been having extraordinary fiscal and monetary policies in the OECD in the last few years, what people call magic money, no limits for budget deficits, and these budget deficits being financed by money creation to make it there would be no increase in interest rates. Of course, this has been giving a sense that there is no limits to the intervention of the state. And a number of my colleagues still are arguing that, yes, indeed, you can basically have an approach by what you need. So you just look at the needs for additional public spending, and then you can finance it by just increasing further money creation. I think this environment will very shortly cease. We'll see central banks restricting their purchases of public debt. We'll see governments facing new constraints. And as I said before, the EU, at the end of the day, will end up with a new fiscal rule that will be probably more intelligent and more flexible than the previous one, but still that would limit the capacity to expand public spending forever. So we have to again, my previous point, we have to be able to demonstrate that the number of public spending or public investments are efficient and produce more growth because they will be treated differently. Monetary policy is very interesting because on the one hand, we have crazy money supply. Just to give you a flavor, I mean, in Europe, the amount of money circulating today is 3 times more than 2 years ago. Just to give you a flavor of what we have. So we are flooded with liquidity. So the good thing is that we are flooded with liquidity, and this liquidity can be invested. So there is a lot of money to invest everywhere, in the funds, in life insurance, everywhere, and with very low rates continuing. So this is a positive thing. The bad thing is that there is a big incentive to invest this money in very speculative investments, not in investment that has a positive effect on long-term growth. Take cryptocurrencies. This is a very hot debate, as you know. Worldwide, I mean, $2 trillion have been invested in cryptocurrencies. These $2 trillion have not been invested in efficient investments that will have an effect on welfare and growth in the medium run. So I think we have to be very careful about this move towards what a number of people call this speculative economics, where there is this big incentive coming from very low rates to go to speculative investments, not to the most efficient investments. And you have to be very aware of that. And this is my last point, because I still have a negative time left. But I think we have to realize how important is this opportunity that we have this mass of accumulated savings that just wants to be invested. In a country like France today, you've got 170 billion euros of unused savings, which still have to be invested here or there. And this is a fantastic opportunity, I think, to channel more money to more efficient research and investments. Thank you very much, Christian.
Thank you for underlining this capacity to rebound with this huge amount. The figures you mentioned are very impressive. So I'm very pleased now to give the floor to Chicago Booth University, to Mr. Randall Kroszner. Hello.
Hello.
I think that the technique is perfect. It is very, very sunny in Boston, in Chicago, sorry. And the floor is yours.
Thank you very much. I'm delighted to be with you. I'm actually here on our London campus. We recently moved from one part of the city of London to right next to St. Paul's Cathedral, as you can see here.
We like London too.
And I look forward to having all of you visit us here at our new campus. So thank you very much. I think this is a very important discussion that we're having, both on the macro issues as well as the healthcare issues. And I think they're very closely related. Because of course, the ability to rebound from the shock of the pandemic is crucially related to the development of vaccines, the development of pills that may help to reduce the severity of the disease. And there's also been an enormous amount of innovation related to telemedicine. So the macro and micro health issues are very closely related. We couldn't possibly be having the recovery that we're having globally, or in many parts of the globe, without that kind of innovation. And so I want to pick up on a few themes that Monsieur Pierret had mentioned about the importance of equity, that Monsieur Gattaz had mentioned about regulation, and Monsieur Artus had mentioned about the importance of sort of bottom-up development. And as I'd said, this is extremely important for thinking about the macro issues. So, for example, we know that there's been innovation both in the US and as well as in Europe for the mRNA vaccine. And exactly as was said, it was extremely important to get equity investment in both of those. In both of those, without that equity investment, that innovation would not have been possible in Europe or in the US. I had done a road to economic recovery talk here at through the London campus with David Moline, one of our graduates who is the chief financial officer of Moderna, and he emphasized the importance of that. He also emphasized the importance of the so-called Operation Warp Speed in the US, which put public money at risk, exactly as was just described by Dr. Artus, that what the US had done was say, well, we're going to take a chance on these different approaches. We are going to pre-purchase and so give money to companies that have not yet actually produced a vaccine, because we think this is so important that yes, some of these will work, some of these may not work, but we're willing to take that risk because if we can get the vaccine out more quickly, if we can develop the vaccine faster, it's worth spending those few extra $1 billion. Because a few $1 billion relative to the size of the US economy of 20 trillion or of the global economy many times that size is small. And so being able to take those kinds of risks, to be able to take those sort of calculated systematic risks is, I think, extraordinarily important. And Moderna could not have produced what it did without that kind of public-private partnership, but also couldn't have done it without the initial equity investment. And so one of the issues that we face globally, but I think Europe faces in quite a bit, is trying to move from ideas and research into practice. And so I think the first step in order to do that is really develop cross-disciplinary collaborative efforts between business schools and medical centers and medical schools for training and for research. And at Booth, we have a healthcare initiative launched in the summer of 2020 doing exactly this, of bringing together researchers in the medical school and researchers in the business school, as well as students from the business school who want to help to drive innovation. And that's the second step, which is developing incubators and developing accelerators to try to take these ideas and commercialize them, because that's the way that you develop the vaccines. That's the way you solve problems. That's the way that you drive innovation and growth. And exactly as Monsieur Pierret had said, it's crucial to develop that intellectual property and then drive growth with it. And an example of this is the New Venture Challenge structure that we have pioneered at the University of Chicago, which has students compete and as part of their program, come up with ideas. They then present those ideas to a panel of judges who are real investors and who are real entrepreneurs. And then there's significant seed money that is awarded. And what's been interesting is if you look over the last few years, there's been an increasing attention to healthcare. For example, the Global New Venture Challenge, which is for our executive MBA program that's here in London, Chicago, and Hong Kong. The winner was something called HeartScreen. And it's a subscription-based telemedicine group that is going to use a digital telescope to acquire heart sounds in real time. So just think about the value of that anywhere someone may be having some sort of issue, you can monitor them quickly, monitor them immediately, get the information in, and save lives. And so this was a combination of bringing together people who have medical degrees and business degrees to try to solve a real problem. And they were awarded $70,000 of seed money from our Global New Venture Challenge, and they're also raising equity money from others. The second place winner was a drug device combination platform that was from a group here on our London campus that can help to improve patient outcomes and reduce costs. And so again, it's this, I think, cross-disciplinary bringing together of people in the medical field, bringing together researchers with people who understand how to run businesses and commercialize things is extremely, extremely important. And so I think the bottom line is that if we think carefully about developing cross-disciplinary research, introducing business people to the health researchers, making sure that there's a good collaboration that occurs in the idea generation part, then taking the next step to move to intellectual property, making sure that there is a bottom-up approach, that there isn't so much regulation that prevents people from trying new ideas, trying new things in telemedicine. That's extremely important. And then providing the equity, and that also provides the incentives for people to move into this field. I think that's the key way to drive a robust and resilient recovery, and also very significantly improve health outcomes for people around the world. Thank you.
Thank you very much. Thank you. Mr. Lepine, you're talking from your office. You have the floor. It doesn't work. We don't hear you.
Yeah. Okay. Good morning.
Okay, it's okay.
I'm very sorry. Actually, I was supposed to be in person with you, but first, which was surprising, was identified as a contact person. So I didn't want to put at risk the HTID Congress.
Well,
and that's why I have to move to the video conference. I'm very sorry for that.
Even that is at the end of the crisis. Don't worry.
Yeah, exactly. But fortunately enough, I'm immunized, so I think the risk is very, very limited for me, at least. I would like to thank you for giving me the opportunity to share with you the experience and I would say the point of view of the biotech and industry in order to enable Europe to better respond to potential future markets. And to do this, I propose to share with you first our experience as an actor who is at the heart of this problematic of anticipating emerging infectious diseases. And the second is to look at how we learned from the current SARS-CoV-2 pandemic at European level and the very positive outcome we had. And the third, a lot of hopes and a positive expectation we can put in the new organization, especially the HARA organization. And I was very happy to hear from our president, Emmanuel Macron, that it can call it as a European BARDA, because I'm a strong supporter and believer that BARDA organization is really one of the good direction we should take. This being said, I just want in a few words to come back to our experience in the past decade. We were created in 2009, and precisely our objective was to anticipate the threat of emerging infectious disease by using polyclonal antibodies, using a very well-known and state-of-the-art technology, which are used as a platform. And thanks to this platform, we can develop a product in less than 12 months to be in the first human use, which is quite quick for treatment. We are now in the 2010 when we started the first product, which was H5N1. And you will understand why I tell you about this story. We were in the context of the 2009 flu pandemic. And we could come up to the end of the development of the product, but unfortunately, as soon as the product was developed, the pandemic was controlled, and the interest suddenly disappeared, leaving us with a product. And I wouldn't even imagine all the spending we had in the past without having a chance to recover it. 5 years after, same cause, same effect. During the 2015 Ebola epidemic, the WHO contacted us, knowing our technology, to develop an Ebola treatment, what we did. And the product was almost developed, was supported even by the French government and European funding. And when Mr. Artus mentioned that the public funding money should put at risk, we could experience that this was done. And I'm a strong supporter on the fact that this could be even encouraged. But as I said, same cause, same effect. The interest from the product vanished with Lepine in 2016. And again, all the effort, resources, including public grants, was spent for nothing. And even worse, the company was put at risk and with a risk of having to close the company. And what we learned from that is that we need to anticipate the risk. That's very important. The risk is part of the biotech, I would say, DNA. And the second message was that it's very difficult to work in emergency. We could see that from the COVID situation, all the effort we put for COVID was put in emergency, although you could have had more time to do it during the peace, if I may say so, period. We need to react quickly. That's something that everybody agreed on that. We need to have a very important industrial platform in Europe. We experienced the fact that during the COVID crisis that many raw materials was coming from outside Europe, and we were very dependent. When I say we, it's not we as a Fab'entech, is all the industry was put at risk for that. And of course, we need to have a very strong public financial support. But as mentioned by Randall, it's much more in terms of pre-purchasing. I appreciate very much what you mentioned, Randall, is the fact that the pre-purchase should be put for different products, even the products which are not developed, because the cost of not having the product is much more important than the cost that could be lost if the product is not developed. The lesson that we learned from during the COVID situation is quite positive. Although we were not prepared, and that's not a surprise to anybody in terms of having access to vaccines or the manufacturing, there was very strong dependence from foreign countries. We have to say that there is a very, very positive lesson learned in terms of fantastic reactivity, the capacity of the scientific community, the public health and research to mobilize and to coordinate all the efforts. And also what we could observe is that it was a change to give more chance to a disruptive technology like RNA. And that's something which is also important to underline, that like during the war, that's at that time when we can see the major innovation that will come. In terms of organization also, we could see that, especially with HERA incubators and nothing at European level, the need of getting more organized. It's not time anymore to think on the countryside, but much more to think at the European level. The pandemic is not a question of France, Germany, it's a question of Europe. And the manufacturing was important. We experienced all this positive effect in the 2020 when we launched our program against SARS-CoV-2. We are leading a European consortium who was selected by HERA among 11 other programs, which illustrate the very strong support from the European Committee, in addition to the one we get from the French government to increase our manufacturing capacity. What was surprising to us is the process was incredibly easygoing, quick, and very effective. I shouldn't make it negatively, but it's very important to notice that it takes only a few weeks to get an answer, and that's very important for us. It's a collective success, of course, of all the partners of the consortium that was able to mobilize themselves. And the third point, which was very important for us, is that ERA, we understand, is not looking only to finance a COVID project, but is looking to finance a platform through the COVID project that will be used for other projects. And that's really a change in the paradigm. In the past, the funding was going much more to finance a product. And as I mentioned, for H5N1 and Ebola, if the threat disappears, it was moving to nothing. Now, we believe the investment is going much more to a platform in order to anticipate the further risk. And that's the same for the EIC program, where we are participating, which is looking for longer partnership, having both public grants and private equity. We believe there are solutions, and of course, to be reactive. And I appreciate what you say, Mr. Artus, is that the risk is our DNA, and it's very important to see that now the public. I should say now, of course, it was the case in the past, but much more now. The risk is also in the public health company, because everyone understands that not taking the risk will cost much more money than taking the risk together with the private company. And we need, it's absolutely key to have a long-term vision. It's when we are a small company, even a middle-sized company, it's important to understand what are the needs, what are the priorities. We don't have all the time the good vision, what are the needs at the European level. To invest in manufacturing capacity, that's good, but also it's important that our facilities is kept alive, I would say, and so that we continue to produce. If we invest one day, but we don't continue to produce product to stockpile, when we will need to reactivate the manufacturing facility, it will be too late. Either the company will have disappeared or the equipment will not work. So that's important. And I would say as a conclusion, in order not to be too long, I am very optimistic for the future, and I'm looking at what has been achieved during this crisis. The capability to act, the strengthened relationship we had with both the R&D and also the public health, investment in new platform in industry, that's new, really in the fact that we can produce in Europe, and a very concrete measure. And as a strong believer, you have understood that a model similar to BARDA at the European level would be very good. And I'm very happy to see that it's not only feasible, but it's already ongoing, and that it will change the paradigm. And I would say to the end that such event like HID is illustrating perfectly well the capacity we all have to be together and get organized at European level to meet this challenge. Now, those initiatives must go to the end to allow Europe to reaffirm its leadership and sovereignty. That's very important, especially in facing other competitive needs for the product, like if you allow me, Randall, USA or Asia Pacific. Thank you very much.
Thank you very much, Mr. Lepine. The floor is yours. Jan-Philipp Beck, you were introduced this morning, and if you want to go there.
Yes, if I may, I would stand.
Yeah, sure.
It's wonderful. Thank you very much. Thank you. Good afternoon. Great to address you again. So this will be the last input from the panel, and then we will discuss. I will see to be concise. So I would like to discuss two areas of fragmentation and see how we contribute to addressing those. And one is market fragmentation, and the other one is the fragmentation of innovation ecosystems in Europe. So in health and in healthcare, as McKinsey called it, our domestic value pool is significantly fragmented. So at most basic level, the fact that Europe is not a single market has, of course, profound effects on what startups must focus on, especially also already in their early years. So we have lowered borders in Europe, we've opened markets, but it's still a collection of dozens of different countries with their own languages, cultures, and governments. All of that is beautiful, but of course it also means extra effort. And that's the case for healthcare, of course, in particular, where pathways to reimbursement vary. So internationalization is absolutely unavoidable for Europe's startups. So to achieve valuations typical of US startups, European companies must expand quickly and also early across many countries. So for a European startup to address a market that is similar in size of that to the United States, it would need to enter 20 plus heterogeneous countries. So across all sectors, most European unicorns have had to expand not just beyond their individual countries, but also beyond Europe as well, whereas only half of US unicorns have expanded outside continental United States. So that means that European startups have to focus on wider internationalization earlier in their journey than do US startups. So what can we do? I think we can start playing better on this largely given playing field. So at EIT Health, we, for example, run programs that support and also give services to support startups with their soft landing in other markets, and thereby also strengthen these efforts for early internationalization. But I think we also need to work on redrawing some of the lines on the field, try to impact that playing field. So for example, initiatives like the European Health Data Space, I think are important efforts to integrate. Also the push towards a more integrated digital single market will be important. So we still need more Europe, but we of course need to do it well. So our own reports also at EIT Health, under the umbrella of our think tank, they show that, for example, we struggle still with the application of GDPR in different countries. We are all aware of the risks connected to the new medical device regulation. So we need better regulation, less barriers to fuel post-pandemic growth. Now, some member states have recently experimented with new regulation, for example, to accelerate digital health to market. And it was interesting to learn this morning from the president's speech that he said he would copy Germany's digital health legislation. I find that very quite remarkable. Maybe we can think of a European digital health highway that also small companies can drive on to rapid growth. By the way, our German team at EIT Health has collected a lot of learnings from that digital health legislation that the president was referring to this morning. So if anyone interested, we can make those available to see how that went, because it's still very new. Now, another area, of course, allow me to advance the hypothesis that innovation super hubs, as you may call them, which are densely packed with resources, they are an asset for fostering innovation growth. And we stand today in one of those hubs here in Paris. And actually, health innovation here, it needs equity and access to finance, but it also needs expertise and professional services, talent, continuous collaboration across academia, healthcare provision, and also payers. Now, these super hubs, such as those that we might find on the US East Coast or the West Coast, have a really high concentration of entrepreneurs, talent, and investors. And we may consider maybe Paris, potentially also Berlin or Stockholm, and of course also London, leading hubs in Europe. Yet they have not achieved the same concentration in terms of capital, knowledge, and talent. So I think only around 30% of European startups have actually located their headquarters in these kind of hubs, where they might have easier time attracting talent and funding, while in the US we see a much greater concentration, around half of them are flocking there. Now, the EIF and Invest Europe have recently found in a report, I think that was released last week, that actually turns out that VCs and startups do cluster, though, more and more also in Europe. So quoting from that report, more than 50% of all VC firms operate in large cities in Europe, in comparison to only 34% of the startups that are flocking there. So as a result, a few important hubs capture a significant share of the VC activity in Europe. Moreover, also according to that EIF study, there are 14 high-profile regions in Europe that appear on both sides of the equation. So they have a lot of high startup concentration as well as VC activity. So we see a bit of concentration. It's a trend. And I think there is definitely an opportunity there. So it should enable us to make it easier for investors to find attractive investment targets, and anything I believe that makes that easier is progress, especially of course since the appetite is there. We see investment volumes grow, and innovation in health and healthcare may well contribute to post-pandemic recovery. So in recent years, I think also US funds have expanded presence in Europe, and European VC has raised more money. Yet it is still, depending on what data you look at, something between 10 and 14 hubs in Europe. So I do not share the concerns at all that were also quoted in the report that this concentration may be harmful. I think it's rather still a lot of fragmentation. It's part of the reality that we cannot change, so we need to focus on the opportunities. So I'm excited that we can come together here in Paris to discuss these trends and opportunities. And I think all of us have something to contribute to support innovation that can really truly impact patients and strengthen our healthcare systems and our economies alike. So what are the lessons learned, and how can EIT Health make contribution? So as these higher profile regions are emerging, I think we still need to connect them better and better. And I think mastering COVID-19 has taught us how to manage distance. And maybe it should be a good reason for us in Europe to be very optimistic. So we will never create the one European super hub, but we will need a tighter and tighter network to foster European and global partnerships. And these partnerships need to encompass the collaboration between ventures and investors and academia and industry. And EIT Health is just one of those partnerships in Europe. I think also that governments could further this through more risk-willing capital that was also mentioned during the discussion, and considering, of course, also allocating some of these semi-public funds towards growing these ecosystems. So I think we need to pay more attention that these funds flow into startups with solid assets, proof of concept, and products, and are not purely speculative. So now this is happening as we will continue, of course, also discussing the Venture Center of Excellence at this conference that was already discussed at the opening. And I think that is nothing less than the ambition to build critical mass amongst European public and private investors to manage larger rounds. And I think this combination is important because we need the market intelligence of the private investors. So I'm glad that we have been fortunate to develop that proposition also together with the EIF. And I think with the EIF now being committed, with a number of VCs being committed, and a number of corporates also standing ready, we are planning to launch also and facilitate first deals there soon. So let's connect our entrepreneurs and investors across borders. Let's further cut red tape at European borders. And I think that will help us to support post-pandemic growth. Thank you very much for your attention, and now we can discuss.
Thank you very much, Jan-Philipp. As the panelists are seem to be to agree to each other, I ask if you have some very short questions with a microphone. You raise the hand, please. Well, I really appreciate if somebody do not agree with what was said. Well, you decided to be very cooperative with the problem of timing. Then it lasts 1 minute, so. No question. Thank you very much for the panelists, and thank you for London and suburb of Paris. Thank you very much, and up to a new growth, up to a new organization and utilization of the money, of the helicopter money, is at your disposal. Thank you very much.
Thank you.